Welcome back to the Hill Update. I'm your host, Dean Allison, Member of Parliament for Niagara West. Joining me on the show today is Mike Sikora, who is a master's degree from the University of Fraser Valley in social work and has made his life's work about helping those that are less fortunate. Let's talk a bit about some of the solutions, okay? And before we do that, let's look at this clip from the House Commons.
Mr. Speaker, when we were in government, there were 60% fewer overdose deaths. This problem accelerated after he brought in these radical programs that are not done anywhere else to give corrupt pharmaceutical companies money to hand out more drugs. David McAvoy, an addiction outreach worker right here in Ottawa, says that he witnesses the so-called safe supply clients diverting their taxpayer-funded drugs to the black market and that they are given, quote, an insane quantity of drugs. Will the Prime Minister stop giving out insane quantities of heroin-grade opioids and start bringing treatment so we can bring our loved ones home drug-free?
Okay, Mike, so in Alberta, certainly they've talked a lot about treatment, as well as the leader of the official opposition talks about treatment there. So in this final segment, I think we should talk a bit about what are things that government could do better in terms of treatment, and how do we help those most vulnerable? In other words, where should dollars be spent? You raise a great point in terms of the continuum of care in your community, the lack of beds that are actually there and available. I'm assuming there's a large cost for that. Some of them you have to pay for. Some of them are probably subsidized by other community service organizations. Talk to us about where we need to do a better job.
Yeah, thanks, Dean. Again, another great question. When we think of access to treatment, often here referred to as a two-tiered system. You've got your government-funded beds that might be 30 to 60 days, but then you've got the beds that are $500 a day or $700 a day, or that the individuals who have a good job, their insurance can cover. And so you can get into one of those often within the week. If you have that higher tier, if you're employed or if you have the funds. And so an area where I think we see this in Alberta, they call it the Alberta recovery model, is the provincial government's really doubling down on. We understand that there's needs and funding beds, funding detoxes, funding beds, funding recovery communities, recovery capital schools to support individuals post that life to have some stability and a firm foundation underneath them as they move forward. And in communities that don't have that, it's a real need. If there's nowhere for individuals to go, you're spinning your wheels. The outputs are huge, but the outcomes are challenging.
We've had guests on the show, George Glover, talking about a longer model, like where people could be in treatment or up for a year. Some treatments can be as short as 30 days. I mean, is there any sweet spot? I realize that everyone's going to be a little bit different, but any thoughts in terms of what's the minimum amount of time that people need to be able to access treatment if it's going to be lasting? And I realize that every situation is unique.
Yeah, there's a term on those 30 days treatment centers. They call it a spin dry treatment center. If you've been using substances or drinking alcohol for 5, 10, 15, 20 years, 30 days out is really not enough, because first you have to just get your head cleared from the things that you've been doing. And once you get your head clear, then you can start to work through some of the counseling pieces or the family dynamics pieces, but that takes time. And so I know I wouldn't put an exact number on it, but 6 months to a year is probably needed, especially for the gravity of some of the things that people are going through.
And let's talk about detox a bit, because I don't think treatment and detox are two different things, which I don't think people understand. So we have safe supply, which is trying to keep people alive. Detox is a period of time where you would need to be there. How long typically may you be in detox before you were able to access treatment? And do some of those facilities do both?
Yeah, there are some facilities that do both. Again, generally the higher tiers of the private centers that you're paying a lot of money would have detox on site. Medical detox it's changed over the years. I mean, 20 years ago, you could be in there for 4 to 6 days. Now you're looking at 7 days to 2 weeks. The drugs have changed, the instability, the poly substance use. So what I mean by is using multiple drugs or different types of drugs. And so the detox is the period where you're getting that out of your system. You might not get all your mental faculties back, but you're getting the dope sickness out, to use that term, before you go into a place where you need to have some level of stability to start your recovery journey or your treatment journey. So a very important piece, because it's really challenging if you were to take an individual that's still detoxing, and I don't know if you've seen the detox from opioids, but it's horrible. I mean, I've had people detoxing in my house on my couch for a week and a half, and it's like having the worst flu in the world every day, all day, times 10.
Well, and once again, why it's so important to have family and friends as support. Like, thanks. That's all the time we have. Thanks for joining us. We'll get you back another time to talk about other things.
Thank you very much for having me.
As we can see, drug addictions are a very challenging thing, and we do need a continuum care. We certainly need more treatment beds, and we can never underestimate the value of family that is there for support. Thanks for joining me on the Hill Update. I'm Dean Allison, your host. Until next time.